In this video, I'm 38 weeks pregnant. I'm being treated by my husband, Edward Paget. Osteopathic treatment during your pregnancy can help to alleviate a lot of the common aches and pains that come with each progressive trimester as the baby's growing inside of you. Each area of the spine has different needs that it has to cope with. The upper back needs to be mobile to twist freely. The lower back needs to be mobile to bend forwards and backwards freely. The neck has to be able to bend and also to twist in all different ranges of movement. Now, as the baby's growing, it's putting a lot of pressure onto the big muscles in the back that connect onto the lower ribs and into the diaphragm. There's also a couple of big muscles in the front of the belly, the psoas muscles, which were commonly known as your hip flexors, that you may find get really tight. Treatment through the whole rib cage can really help to ease some of these common places of tension. One thing that not a lot of people know about is that reflux from the stomach, acid reflux, can be treated quite effectively with osteopathy. I didn't appreciate how uncomfortable reflux can be until about halfway through my pregnancy when I began to cough because the acid was so strong. So working directly on the diaphragm can help to open up the space that gets really crowded and also to stretch those abdominal muscles, which are putting a huge amount of pressure onto the stomach. The stomach itself is going to be a little bit more predisposed to reflux because of the hormones circulating, which make this tight sphincter around it a little bit more relaxed. So if you can take off the pressure around that sphincter, you can often get some great relief from reflux, which can be so uncomfortable. We also think it's really important to treat other areas of the spine, especially the low back. You probably have found that you've been able to stretch it in part and get some relief, but it's hard to get a full stretch that will actually decompress areas of the spine into the lumbar spine and down into the joint between your sacrum, which Ed's just put his hand on just there, and down into the tailbone. These areas are particularly vulnerable to compression, and it's really important that they stay free and mobile. Also, the big supporting pelvic muscles, which you can see Ed working on here. Although we will have checked this throughout your pregnancy, towards the last month of pregnancy, we really like to make sure that both the sacroiliac joints are working. These are the joints between the sides of your pelvis and your sacrum, also down into your tailbone. If these areas are working really well, it means that the baby should be able to be comfortably positioned and your body is in as good a state as we're able to help you with for labour. We wish you a great pregnancy and are here to help you with this complex time of adaptation where the body's needs are changing continuously.